Wesley Evans, and I am the statewide coordinator for the Department of Children and Families, Integration and Recovery Services. And today we're going to address working roles in recovery. And this is peer specialists. Do we have peer specialists here? Okay. Well, today's topics that we're going to cover, we're going to talk about the role that peer specialists can play, principles, values, the benefits of peer specialists, and talk about the outcomes, training that is required to become a certified recovery peer specialist, supervision. Supervision is a very important component of having a successful peer worker, and teamwork. How do peers integrate into a whole treatment team?
With a clicker.
Yeah, I know. So let's start with, let's go back in time a little bit and talk about the history. In 2003, the President's New Freedom Commission on Mental Health published a report. And this report was very instrumental in really playing a catalyst role for the proliferation of peer supports throughout the country. And in the report, they found some obstacles preventing the excellence of care within the behavioral health system and the mental health system overall. And those points were stigma. Stigma exists throughout the behavioral health system when we look at mental health and also substance abuse diagnoses. But it also exists in other areas. Unfair treatment limitations and financial requirements place on benefits and private health insurance. Oftentimes, a lot of times individuals, maybe with mental health diagnoses or substance abuse, find it hard to, or difficult to find a job. And it's difficult to get the health care that you need if you don't have insurance. And so that can oftentimes become a barrier. Also fragmentation of the service delivery system. And that is something that is improving greatly. And those barriers and those silos are coming down. And so what the country really did is took this report and really looked at this report in a comprehensive way and started moving the system in a positive direction to really address a lot of the issues that were brought up in the report. So let's look at the definition of recovery. Okay? Recovery is a process of change through which individuals improve their health, wellness, to live a self-directed life, and strive to reach their full potential. And we have four components that encompass that recovery, and that is health, home, purpose, and community. So, what is a peer specialist? A peer specialist is defined as an individual who self-identifies as a person who has direct personal lived experience living in recovery from mental health and or substance abuse conditions. So that's what we're talking about in this context when we're talking about peer specialists. But we can use peer specialists in a wide variety of supports. So a peer is someone with lived common experience. So what are the principles and values of peer support? So the principles and values are recovery-oriented. Peer workers help those they serve identify and build on their own strengths and empower them to choose for themselves. And there are many paths to recovery. You know, recovery is not a linear process when we're talking about recovery. Recovery, I like to see as a puzzle. And it is us who get to choose the pieces that we place in that puzzle. And that's kind of exciting because that gives us power. That gives us the power to move our own life in the direction that we want it to go. And so peer supports are person-centered, and I was just talking a little bit about that. When we think of person-centered, we think of the person. And we're asking the person because that individual that is being served is really the expert on themselves, because we are all the expert on ourselves, right? Yeah, absolutely. And so peer support is personalized to align with the specific hopes, goals, and preferences of that individual. We really want to have that focus on the individual being served, so that we're not ascribing what we feel would be best for the person, because it's important to get that feedback from the individual and what they would like to see for themselves. It's voluntary. Peer support is voluntary, so individuals do not have to participate in peer support. It is relationship focused, and it is also trauma informed. And that is something that is really key, is being aware of trauma that may have happened to an individual in the past, and so that we're careful not to re-traumatize an individual, or that as a peer we don't suffer ourselves any secondary or vicarious trauma. So we want to make sure that the principles and values also address trauma, and that the training that a peer receives is trauma informed. So what are the tasks of a peer specialist, a peer support worker? So peer supporters provide emotional support, and they demonstrate empathy and compassion. Informational support, and this is really important because peers can pass along information to the individuals that they're working with. And affiliation support, learning social skills. Sometimes if we're living with a mental illness or substance abuse disorder, that can cause us to withdraw from our own communities. And that's very prevalent if an individual is suffering from depression. And that can often happen for a period of years. And so sometimes we may lose those social skills that are really valuable, those social skills that can help us to build positive natural supports, but also get back in the workforce as well. So a peer can help another individual who may have been isolated for a long time regain some of those social skills. Instrumental in support and providing transportation. Sometimes peers will be asked to provide transportation, driving the van, taking individuals to appointments or such, or administrative work. But this instrumental support is not nearly as important as emotional support, the informational support, and the affiliation support, because we want to be able to make sure that the peer workers are being utilized in their full potential. It's hard to provide that emotional support while you're driving someone around. So, peer specialist certifications, and we'll also talk about this a little bit further along in the presentation. Peer certification endorsements, and currently there are 3 types of endorsements. So we see here CRPSA, and CRPS stands for Certified Recovery Peer Specialist. And these endorsements are offered through the Florida Certification Board. And so the CRPSA is an individual that attests themselves to living with either a mental health or substance abuse or co-occurring diagnoses. So this is for an individual that themselves lives with diagnosis. And then we move down and we see the designation F, and that F stands for families. And so that designation is for someone like a parent or a caregiver of an individual that lives with a diagnosis, because that parent or that caregiver has a lot of experiential knowledge that they can assist other family members with in helping to navigate the system. And then finally we see CRPS V, and the V designation is for veterans. And this is a really important designation because we all know that veterans unfortunately come back with a lot of post-traumatic stress diagnoses, and they also suffer during their time and their service in the military with a lot of trauma, unfortunately. But the Veterans Administration has found a lot of value in utilizing veterans who have that lived experience as a veteran and may also live with the diagnoses of depression, substance abuse, PTSD. So they found so much value that they've really started their own programs within the Department of Veterans Affairs and are really using veterans as peer supporters. So what are the roles of peer specialists? A peer specialist provides mutual support, resources, and therapeutic mentoring. They are role models for recovery, and they serve as a mentor and an advocate for the individual. And they support the development of community supports and natural supports that are necessary for individuals to live fully fulfilled lives in recovery. And they also provide support and a listening ear to increase engagement, not only engagement with the peer supporter, but also engagement with the other treatment team and the treatment providers. And they provide real-world advice. This real-world advice is the most powerful tool that the peer has in their arsenal, because it is that very lived experience that the peer utilizes as a tool to assist other individuals. Peers are also change agents. Another important aspect of being a peer specialist and working within the system itself is that change agent for systems transformation. And when we talk about systems transformation, we're talking about being change agents from the agency on the inside, while the peers are working alongside other co-workers. We're talking case managers, counselors, therapists, administration, and by having individuals, by peer specialists being in those roles, those other colleagues, those workers that the peer works alongside really get to see the power of peer support and the potential of other individuals or of individuals living with either mental illness or substance use or co-occurring diagnoses. So let's take a look at a crosswalk and what is part of the role of peer support and not part of the role of peer support. So part of the role is to function as an advocate for the person in recovery, both inside and outside of the program. Not part of the role is to represent the perspective of the program, because we want to remember that the person is at the center of the program. So the use of language based on common experiences and use of clinical language is not part of the role. So peers are not clinical. They do not provide clinical advice or do clinical assessments. The peers, we use language based on common experiences. Mutuality is the key when we're talking about peer supports, and that mutuality of lived experience. So a peer provides encouragement, support, and praises. A peer does not provide case management services. So when we're thinking about peer supports, we're thinking about a separate service. And oftentimes peers can be shuttled or moved into the role of a case manager. And we want to ensure that peer services are viewed as a separate service, because they are. Peer specialist helps an individual set personal goals. We want to remember that the individual is the focus and the individual is the expert. So we want to hear from the individual what their goals are. The peer does not mandate tasks or behaviors. Peer specialist is a role model for positive recovery behaviors. And not part of that role is the peer does not tell the person how to lead their life in recovery. Because again, the focus is the person and it's person-centered. That individual gets to choose for themselves what that recovery looks like. Peer support provides peer support services, and that's a separate service. Not part of the role is does whatever the program requires, because we want to make sure that the peer is delivering those peer services. So this is the really exciting part, because these are job titles that peer specialists can fill. So peer services, as I said before, are a separate service, and it's important that the job titles and the tasks are clearly defined for peer specialists, and those descriptions and titles are based on the services that the peer will provide. So let's take a look at some of those job titles. Self-directed care coach. This is a person-centered goal planning and money management position. So the individual, the peer specialist, is working closely with that individual and really can work as part of a team and helping that individual set personal goals, but also helping an individual learn how to budget and manage money so that they can be successful in their lives and their recovery. This is really exciting when family peer specialists. Again, we talked about that designation with the F at the end, the Certified Recovery Peer Specialist family member. And the family members can really provide a lot of valuable support in this area. And they can assist caregivers, other family members, youth, and individuals themselves to provide system navigation, advocacy for appropriate discharge protocols of loved ones, and one of the positions and one of the programs out there that family peer specialists are utilized as part of a team is the family intensive treatment teams, or FIT for short. And what that is, the FIT team is a comprehensive team. So the individuals and the families being served are served by an entire team of professionals, which includes peer specialists as a part of that team. A veteran peer specialist. And this peer specialist has that V designation in their certification, and they work exclusively with veterans. Recovery support navigator or bridger. This is one of my favorite positions, because when we're looking at one of the priority efforts of the Department of DCF, we're talking about care coordination really when we're looking at this position of a navigator or a bridger. And so the bridger can help with outreach, work with the Florida Assertive Community Treatment or FACT teams, also FIT and jail diversion programs, which also can work in drug or mental health courts. And one of the areas that bridgers can be really successful in coordinating care is within the crisis stabilization units, the CSUs. So that peer may be working alongside individuals in the CSU with individuals and developing that rapport while the individual is in the crisis stabilization unit. And then upon discharge, that peer can continue to work and bridge that individual being discharged to a follow-up service provider, so that we're really making sure that that individual connects to these services that they need to move forward and recover. Crisis recovery support specialists. This is a little bit what I talked about. This would be an individual, a peer, working directly and solely in the crisis stabilization units, the CSUs, working with individuals as they come in, they're being Baker acted, and also continuing to work with them while they're on the units, and also working with care coordinators and working with that peer bridger as they are discharged and moved into the community. an employment support coach. There are several areas within the provider community or support community that peer specialists can work in the role as an employment support coach. And those are clubhouses and also vocational rehabilitation programs. Are you familiar with clubhouses?
I'm familiar, but I didn't know there weren't any in Jacksonville either.
There's no that I know of that I'm familiar with clubhouses in Jacksonville, but we do have clubhouses throughout the state. Those clubhouses, they really have a strong focus on getting individuals volunteering and back to work. So having a peer specialist work at a clubhouse is a really, really great idea. Housing support specialists. This is an area where peer specialists may have lived experience of experiencing homelessness themselves. And so if that individual has recovered and moved forward and created the life that they want to live, and they want to use that experience of homelessness to assist others who may be experiencing homelessness, then they can work in supportive and housing first programs, and also outreach, getting out into the community and engaging other individuals who may be currently experiencing homelessness. Let me know if you have any questions. Well, we went back. Yeah.
I noticed crisis,
The CSU?
yes, CSU. Is there a function for people who are in the hospital voluntarily? I mean, is there somebody that helps them with that function?
While that individual is in the hospital?
Yeah, as a bridge to when they get out.
That's what the peer specialist could do. The crisis support specialist could work with those individuals who maybe have just come in voluntarily, or who have also been favor acted.
Okay.
Yeah. So because they're all commingled really in some ways, so that they can also work with those individuals.
Oh, good.
Yeah, absolutely. So, to provide all of those really valuable job titles or duties, we have to think about role development and developing that role and making sure that the peer specialist role can be developed effectively. So when we talk about role development, we're looking at peer workers are often at risk for role drift. And this is a little bit about what I talked about before, where sometimes peer specialists will get shuttled into a case management role. And so, an employer might identify some really great, strong skills within a peer worker and, think, hey, they'd be a great case manager. And then start maybe assigning case management duties or roles. And then that role drift kind of seems to happen. But meanwhile, case management and peer services are separate. So we want to be careful that we don't experience any role drift and that the peers really sustaining their position and the fidelity to the peer model. Identify peer workers' strengths and work position placement. So if an employer maybe has identified strengths within an individual that would make them a really great case manager, and maybe that peer has the qualifications and desire to be a case manager, that peer could transition into a case management role, but then that peer is now a case manager and not a peer specialist, so it's a separate role. But when we also think about role development, we want to think of appropriate work position placement. And when I talk about that, using that term there, we want to think about the individual themselves, the peer worker, and their lived experience. Because, as I said a little bit ago, that's really the value, is that lived experience. So when we're thinking about work position placement, someone with criminal justice experience, someone who has maybe cycled in and out of the mental health and criminal justice system would be very appropriate with that lived experience to work with individuals maybe in a jail diversion, mental health, or drug court program, or even working in the jail with the inmates in the mental health dorm, maybe working with those inmates one-on-one, or facilitating support groups in the jail, because that's really making the most of that peer specialist lived experience. Documentation and fidelity of the peer model. Peers use person-first language, and they also do person-centered documentation. And it's important to make sure that this documentation is in person-first language, and that they are demonstrating the fidelity to the peer model. And that's also really going to ensure that a peer is continuing to deliver those peer services in the most effective way and adhering to the peer model. Additional training opportunities. This is a really great opportunity to talk about the trainings out there that can help further develop a peer's skills to maybe expand their role. So when we're talking about additional trainings, we're looking at RAP, whole Wellness Recovery Action Planning, which was developed by the Copeland Center, Dr. Mary Ellen Copeland, and whole health support, motivational interviewing, and trauma-informed care. These are all additional trainings that a peer can receive to really assist them in their roles in working with other individuals. Are you familiar with RAP?
Yeah.
So Wellness Recovery Action Planning, I'll just explain a little bit about it, is a tool and a plan that a peer utilizes not only themselves, but in working with other individuals and to develop resilience and sustainability in wellness, and also some crisis planning as well. It looks at identifying triggers, early warning signs when things are breaking down, and also a RAP plan does a great job at also taking into consideration the coping skills necessary to deal with those early warning signs, and as well as bringing supporters into that plan. You know, who do I want me to help, or who do I want to help me in maybe my crisis stage? Who are my supporters that can really help me not start to isolate? And whole health support. There's a curriculum out there, peer whole health support, that is fairly comprehensive and focuses on the whole person. And then motivational interviewing. There is a clinical motivational interviewing training, and there's a specialized motivational interviewing for peer supports, which can be really effective in helping a peer develop skills for working with individuals. And trauma-informed care. Trauma-informed care is so important that we have that knowledge about trauma and the effects that it can have, not only on individuals who may have experienced trauma years ago in their lives, but also being aware that an individual can be re-traumatized if there's maybe some triggers that have been identified. So it's really important that peer workers are aware of that trauma and the warning signs related to that trauma. Career ladder opportunities. Want to make sure that those opportunities for career advancement are there and in place for that peer. So I'm talking that peers can be supervisors. One of the best practices is that peers supervise other peers because they know the role, they know what it's like, and they really understand peer supporters. So we want to make sure that peers have those opportunities to advance in their career, so we're not hitting a glass ceiling. So, what does all this do? What do all these roles do? They improve outcomes, which is really what we want to see. We want to see individuals moving forward in their lives. We want to see individuals getting well, moving into creating the life that they want to create, and that is a life outside of the mental health, criminal justice system, substance abuse system. So there's significant research that shows that peer supports are effective in many outcomes. Engaging and retaining individuals within the provider service arena. So peers have the ability to really keep that individual engaged in services. So if an individual is not showing up to their appointments with their therapist or case manager even, the inclusion of a peer can really help to keep that individual engaged in those services. Supporting individuals and playing an active role in their treatment through empowerment. And when we're looking at this and playing an active role, we want to make sure that that active role is the person-centered planning and the person-centered treatment approach that we're talking about. And we want to make sure that that individual receiving services is at the table. We want to make sure that there is nothing about me without me. I love that. That's one of my favorite sayings. Nothing about me without me. So we want to make sure that that individual is sitting at the treatment team table while that treatment plan is being developed. And the individual's voice should be in the treatment plan. And so we want to make sure that we're empowering that individual to feel that they have a voice and they have a right to be involved in their treatment. Lowering rehospitalization rates. This is really important. Lowering the hospitalization rates of individuals so that individuals do not keep cycling in and out of the system. And reducing utilization of crisis emergency room services. And that's a little bit about what I just talked about, is making sure that a peer and a person is engaged in their treatment and bridging that gap between the crisis stabilization units and the provider on the other side that is going to provide those follow-up services. So they can reduce the utilization of those crisis services, and the peer bridger can play an important role in that outcome because that peer maybe has been there. And so that peer can work with that individual to make sure that they're connecting and coordinating their care to their follow-up services. There's more improved outcomes, which we like to see. Increasing the overall satisfaction with services, providing knowledge about psychiatric disorder and addiction and management, assisting connecting to communities. I feel that connecting to communities is one of the most important components of recovery, because recovery really happens in the community. It doesn't really happen in the doctor's office. It happens out in the community, making sure that that individual is connected to community and natural community supports. You know, I talked a little bit about the isolation that individuals will sometimes experience if they live with a mental health or a substance abuse diagnosis, and sometimes losing those social skills over the years. So getting back out, getting contacted with positive community supports is really important, and a peer can help an individual do that. So reducing symptoms or substance abuse, improvements in practical outcomes such as employment, housing, finances, increasing the ability to cope with stress. Peers, what they do, as we've been talking about, is peers utilize their own lived experience as a tool to assist others. So a peer is working with an individual and can teach them how to cope with whatever symptoms or feelings they may be experiencing. That peer can say to that individual they're working with, you know, I remember a time when I felt really anxious and I didn't feel that I could walk into a room. Well, I understand that. And this is what helped me get through that moment of anxiety. And then that peer specialist shares that tool with the individual. And maybe it will help that individual also. And it also helps understanding that there is that mutuality. Oh wow, you've been through that too? I'm going through that. That immediately can reduce a lot of anxiety. Increasing the quality of life of individuals, increasing the ability to communicate with mainstream providers, opening and maintaining a positive line of communication between the treatment team, significant reduction in inpatient days. So perhaps that individual is not going to be in that crisis unit for a week or 2 weeks. Maybe they're just only in there for 3 or 4 days. Reducing relapse and initiating recovery engagement while relapse occurs. So we try to keep that individual engaged. So often the most crucial component to peer worker success is quality supervision. So when we're looking for supervisory success for peer supporters, we need supervisors that are also change agent champions. When we talked a little bit about peers being change agents themselves, we really want to see a supervisor for peers be a change agent themselves and be a champion for that peer. So the peer supervisor considers consider peers as supervisors. It's a best practice to have a peer supervising another peer. And that also provides an opportunity for career advancement as well. That supervisor is committed to the concept and the culture of recovery, making sure that that supervisor really has an understanding of what recovery is, and recovery in terms of how the individual defines recovery for themselves, and that it's not a linear process, and that it is a process itself. So that's really important that the supervisor understands what that recovery is. And understanding the value and philosophy of peer support, making sure that the supervisor really has bought into the value of peer support. And that can also go back to the individual, the supervisor being a champion for the peer and their role. And aware of stigma and discrimination within the workplace itself. This happens more often than you may think or realize, but stigma is so powerful. Not only do we see stigma out in the community, but we also realize and live with self-stigmatization. And that self-stigmatization can sometimes be more crippling than a diagnosis itself, because it can be paralyzing to an individual. It can keep an individual from getting out there, maybe getting that job, maybe going out and socializing, talking to others about their diagnosis, talking to their family members, their friends. So being aware of the stigma that may exist within the agency itself, stigma that might be coming from the co-workers of the peer. So some supervision basics. Helps the peer to understand disclosure and when it's helpful and when it's harmful. I always, when I do peer specialist trainings, I make sure to tell individuals, I say, don't give it away. You know, use your experience because your experience is valuable, but make sure that you're using it in an appropriate way. Make sure that you're not divulging everything all up front, right, when you're meeting the individual. You want to reveal it when it helps. And the supervisor can help the peer workers who recognize that. So guidance on boundary issues in navigating dual relationships. Oftentimes, well, not oftentimes, there are differences between clinical boundaries and peer support boundaries. Clinical boundaries are a little bit more rigid than peer boundaries. But those boundaries are there, and those boundaries are important. And the peer specialist, the peer worker, wants to make sure that they're not crossing those boundaries and creating dual relationships. An example of a dual relationship might be, you're working with an individual, oh, I know you need a job. Well, you can come mow my lawn, and I'll give you $20. That's a dual relationship. You want to make sure that you're not crossing that boundary. Provide co-reflection and opportunities for peers to debrief with other peers. As I mentioned earlier, one of the best practices is a peer supervising another peer. But if that's not possible in that role, then having an opportunity for a peer to work with another peer and also get support from fellow peer workers. If peers are being hired, it's a best practice to make sure that peers are being hired with other peers, so that it's not just a lone peer worker over here in an agency of 500 other employees, because it's important to have that peer support for that peer supporter. Knowing the difference in therapy and supervision. Sometimes individual supervision meetings can become therapy all of a sudden. And, want to make sure that the supervisor isn't providing therapy as opposed to supervision, because it's the supervision that's valuable in that moment. And there's a difference. And the best supervision for peer specialists combines support with mentoring and training that improves a peer's skills and the quality of their services. That mentoring opportunity is really important. So if you have a peer worker who's been working within a provider for 5, 10 years perhaps, and you have a peer worker who's just coming on, maybe new to that working role, that other peer that has that experience can really help to mentor that peer. Supervision basics. Supervisors should be flexible, strengths-based, have the same expectations and for accountability, because lowering any expectations is a subtle sign of discrimination. And also those opportunities for career advancement, like I mentioned before. And when I talk about being flexible, sometimes peers may have moments where they have a home group, maybe an AA or an NA meeting that they go to on a regular basis, and they go to that meeting at 2 o'clock in the afternoon. So that individual having that flexibility to be able to go to that meeting, you might think of it just as a doctor's appointment. Sometimes peers, individuals, we have regular medication management appointments, so that we want to make sure that the peers are able to go to those medication management appointments. So having that flexibility is very valuable for the peer worker. So there are 5 P's for supervising peer specialists. Trained in quality supervision skills, understanding the support and the role of the peer specialist, understanding and promoting recovery with other supervisors, an advocate for the peer specialists and the peer specialist services across the organization and the community, promote both professional and personal growth for the peer specialists with established human resource standards. So really helping that peer to move forward in their career and also different roles. So one of the things I did, I wanted to reach out to supervisors of peers, and specifically peer supervisors. So I reached out to some individuals because I wanted to get some practical, real-world experience and notes. So they communicated to me that having an open line of communication, that open door policy, is really important, so that that peer feels that they can always go to their supervisor with any help or guidance or mentorship that they may need. Checking in on health goals as a group. I talked about RAP earlier, so there's nothing that says, the group, the team, the workers, other workers can't do a whole health support plan. So one of the things that a supervisor can do is check in on health goals of the group and the peer worker themselves. Training lowers the risk of boundary violations because when an individual is trained and certified, they are trained on boundaries and ethics in their roles. Peer support for peer supporters and having those community supports of other peers. RAP. And my favorite, the pathology, behaviors of peer, seeing, supervisors, maybe clinical supervisors, seeing the behaviors of peer workers as symptoms rather than work stress related behaviors. Just because I may be in a bad mood today doesn't mean I'm symptomatic. We all have those good and bad days. So teamwork and collaboration are really important. It's important that peers and the treatment team work together, and that the team is assertively engaging providers from mental health services and addiction services and physical medicine to meet the needs of the peers. Coordinates efforts with healthcare providers to enhance the health and wellness of the peers. Coordinates efforts with peers and families. Partners with the community. And strives to resolve conflicts in relationships with peers and others in the peer support network. So, best practice. It's common for peer workers, and it's not wrong, it's common for providers to hire individuals as peers, but maybe not have that formal training or certification. So a best practice is training. Certification allows for competency in the field, and particularly career advancement. And sometimes we'll see providers in the job announcements or job descriptions that you can be hired without training and certification, but within 6 months or a year, you have to get that training and certification. So, how do we do this? How do we get certified? What can certification do? So, talked a little bit about this in the beginning, and those 3 designations for certification, and that is the adult designation, the family designation, and the veterans designation. How do you get those? Well, there's a certification process. The certification is through the Florida Certification Board, and the certification is for a true peer. Now, when we're talking about a true peer in this context, we're talking about an individual that will attest to living with a mental health and or co-occurring substance use diagnoses. So that the individual has to demonstrate competencies in the field of peer recovery, and that training, the curriculum, provides and addresses those core competencies. And the individual must meet the minimum standards for professional certification, including education experience, training, and testing. So when we're talking about the educational experience, we're talking about at least, a high school or a GED minimum. And the training, it's a 40-hour training, which is typically given over a 5-day period. And then there's a test at the end. So, performed work according to professional code of ethics. The Florida Certification Board has a very robust code of ethics, as they should. And so the individual, the applicant, the peer must sign that code of ethics, stating that they will adhere to those ethics. Maintains their knowledge and skills based on completing annual continual education units. So the certification board, in order to maintain your certification, you have to acquire 10 CEUs, or continual education units, each year. Training, how do we get training? So the department whom I work for maintains a registry of trainers who can provide the 40-hour training. And the curriculum that the state has purchased is called Helping Others Heal. This is a really great, really strong curriculum. It's a curriculum that's to be facilitated that 40 hours, and it addresses all of the core competencies that have been established by the certification board, the Florida Certification Board, so that that training provides and meets those educational standards. And there's a link here for where you can find that registry. There are trainings around the state. The Helping Others Heal curriculum is not the sole path to certification. There are other trainings and other curriculums out there that individuals can get to meet those educational standards and become a peer specialist. There is the Peer Support Coalition of Florida. This is a really great resource. It has, I think 600 members and growing every day. The Peer Support Coalition of Florida can provide a lot of resources on trainings and community activities for peer supports as well. And job opportunities, as providers will often go and put job announcements on there. So thank you very much for coming. I really appreciate it. Any questions? No? Thank you.
When do we get your handout, or how do we get your handouts?
Do you have an email?
I do.
Okay, I can send it to you.
Can you send me one too, please?
Mm-hmm.
Thanks.